Continuing our discussion on the connecting or the luo points, we now talk about the use of luo points on their own. The use of the connecting points on their own according to chapter 10 of the spiritual axis. The use of the connecting points by themselves is based on the full or empty symptomatology of each connecting channel. The full and empty symptoms of the connecting channels are described in chapter 10 of the spiritual axis. They are listed in the following table. So here we have the blue connecting points of the different channels and their indications in full and empty conditions. So let's start with lung 7. Right, it's indicated for hot palms and wrists in full condition, and for yoni, frequent urination, incontinence of urine in empty condition. For the large intestine, we have Li6. It's indicated for toothache and deafness in full condition, and for sensation of cold in teeth, fullness and congestion in the chest for empty condition. For the stomach, we have stomach 40. It's indicated for insanity in full condition, for rebellious chi in the throat, if there's throat obstruction and loss of voice, and for empty condition where there is flaccid or atrophied muscle of legs. For the spleen, we have spleen 4. It's indicated for abdominal pain in full condition, for rebellious chi where there is food poisoning, and for empty condition, it's also indicated for abdominal distension. For the heart, we have heart 5. It's indicated for fullness and oppression of the chest in full condition, and aphasia for empty condition. For the small intestine, we have SI7. It's indicated for loose joints, atrophy of arms and stiff arm muscles and stiff elbow for full condition. And for empty condition, it's indicated for long finger-shaped warts and itching scabs. For the bladder, we have bladder 58, which is indicated for nasal congestion, headache, and backache in full conditions. And for clear nasal discharge and nosebleed in empty condition. For the kidneys, we have kidney 4, which is indicated for retention of urine in full condition, and for rebellious irritability, depression, oppression of the chest. And for empty condition, it's indicated for lower backache. For the pericardium, we have pericardium 6, which is indicated for chest pain in full condition, and stiffness of the head and neck for empty condition. The triple burner, we have triple burner 5, which is indicated for spasm of the elbow in full condition, and for flaccid arms and muscles in empty condition. For gallbladder, we have gallbladder 37, which is indicated for fainting in full condition, and for weak and flaccid foot muscles, and difficult to stand from sitting position in empty condition. For the liver, we have liver 5, which is indicated for swelling of testicle hernia-like disorders in full condition, and also in abnormal erection. And in empty condition, it's indicated for itching of pubic region. For the Ren-Mai channel, we have Ren 15, which is indicated for pain in the skin of abdomen in full condition, and for itching of the skin of the abdomen in empty condition. For Du-Mai, we have Du-1, which is indicated for stiffness of spine in full condition, and for heaviness of the head and tremor of the head in empty condition. For the Great Lu of the spleen 21, it's indicated for ache and pain all over the body, and it's also indicated for weak limbed muscles for empty condition. The great luo of the stomach is indicated for rapid breathing, irregular breathing, and sensation of knot in chest in full condition. The indications of the connecting points according to the full and empty symptoms from Chapter 10 of the Spiritual Access do not have the same clinical relevance for all points. For example, the indications for LI6, which is sensation of cold in teeth, fullness, and congestion in the chest, are not of great clinical significance. The indications with greater clinical significance are as follows. Stomach 40 for insanity, spleen 4 for abdominal pain in full condition and abdominal distension in empty condition. Heart 5 for aphasia in empty condition. Kidney 4 for backache in empty condition. Pericardium 6 for chest pain in full condition. And liver 5 for genitalia problems in full condition and itching genitals in empty condition. So to summarize, the use of the connecting points on their own, according to Chapter 10 of the Spiritual Access, states that the connecting points can be used on their own, and that the connecting points are chosen according to full or empty state of the connecting channel. Thank you for your attention.